Authorities in Vietnam have detected a new coronavirus strain that is a combination of the Indian and UK COVID-19 variants and spreads quickly by air. Health Minister Nguyen Thanh Long said Vietnam would soon publish genome data of the newly identified variant, which he said was more transmissible than the previously known types. Vietnam's business hub Ho Chi Minh City will begin social distancing measures for 15 days, starting May the 31st, in an effort to curb the spread of COVID-19, the government said on Sunday. State-run Vietnam news agency reported Ho Chi Minh City authorities would conduct COVID-19 tests citywide with testing capacity at 100,000 samples per day. And General Practitioner and Clinical Director of Chapeltown Primary Care Networks in Leeds, Dr. Abiye Hector Goma, joins me on the news from the UK via Zoom. Good to have you join us, Dr. Hector Goma.
Hi there. Good afternoon.
Sorry, that was a mouthful. Almost messed up your name there. But let's look at the new strain of COVID-19. Once we think that we have seen this virus mutate, it just keeps getting worse. What more can you tell us now about this new variant, which we hear is airborne?
Well, the first thing to note is that viruses mutate all the time, so it's not new. The flu virus, for example, mutates so often that we need to have a different vaccine every year. So it's common for viruses to have a mutation. It's not a big deal. But the only thing that is interesting, as it were, is that this is a kind of a hybrid, a combination of two different variants. And that's just what makes the new Vietnamese one. As you mentioned, you have both the Indian variant and then the variant from Britain. And that's what makes it, in a way, a bit special. We're going to look at the mutation like having a tree and the branches of a tree. The branches are slightly different. They are never really the same. So it's like you have the coronavirus and then you have the mutation. So far, there are thousands of variants, but 4 of them are particularly of concern before now: the Brazilian, South African, the Indian, and the one of Britain. So this Vietnamese one, which is the Indian and British one kind of combining, it's novel, as it were. So it provoked quite some more interest.
Apart from being more transmissible, we also hear that, according to laboratory culture, that it replicates faster than the other variants. Could this trigger a third wave?
Well, when a virus mutates, there are a few things we want to see. One is, of course, if it replicates faster, the transmissibility increases. But then the second thing we want to know is that when more people are now affected by the virus, is the severity any different from the existing ones? Are more people likely to end up in hospital? And if they do end up in hospital, are they likely to recover or they are more likely to die? And those are still early days, and that's where additional effort is being made to go back to do the same old things about prevention and try to reduce the spread of the virus. But is it more severe? I think it's still early days.
We understand that most countries, not all countries, but most countries right now are focused on vaccinating the population, some at a faster rate than others. But does this, however, buttress the importance of vaccinating and testing while vaccinating? Because it looks like testing in some countries has drastically reduced.
Well, I guess every country has a lot priorities, both social and health priorities. So where you have a limited financial capability, you probably would put greater effort on the pandemic if you're having increasing infections. But as you know, worldwide, the infection rate has been going down. So countries that were even very active diverting funds from other areas to put into the pandemic may find themselves going on the back foot. But this is an example. Vietnam had done very well. This is the 4th wave, as it were, in Vietnam. But this is the first one that is really a real wave for them. And that's why there's even additional effort, because Vietnam have been seen as a country which had done well with the preventive strategies initially when the pandemic started. But with this new variant and the fact that you have 47 deaths and about half of the total cases that they have have come from this new variant compared to what has been, and that's why there's quite a lot of concern. And quite rightly, the country has upped its gear, as it were, to look at doing more testing, causing people to have less movement, and reinforcing the preventive measures.
Dr. Abiye Hector Goma, thanks for helping us make sense of this new variant.
Thank you very much.